For daily use, I would say for the public, a cloth mask or material mask is sufficient. We recommend that these should be 3-layer. So when you're looking at your masks, just try and make sure that you've got a 3-layer mask. I would say probably that you would use them daily, but obviously if they're wet or if they become dirty, then we recommend that you remove it and you put another one on. If you come into the hospital, you're issued with a mask. This is again a 3 to 5-layer mask, which is for hospital issue only, because you're coming into like a place where vulnerable patients are. So you will be asked to take off your mask and put one that the GHA provide for you.
There are a lot of questions about how masks should really be used. What are the main do's and don'ts?
What we suggest that you do is wash your mask daily if it's a fabric mask. Never take it off and put it under your chin. Don't hang it on your ear. Don't place it on your elbow. And I know that's very hard because, you know, we are asking people to not wear their masks when they're outside. Then when you go into a covered area that you're wearing your mask. Really important before you put your mask on that you wash your hands. That when you put your mask on that it's adjusted properly. That whilst you've got your mask on, you do not touch your mask, which is very hard. It's very hot. People sweat a lot when you have your mask on, and they tend to fiddle with their mask. You need to cover your nose and your chin and your mouth. Another really important thing is that when you take your mask off, you don't take off from the front, you take off from the ears. You wash your hands before you touch your face, and then you wash your hands after you've removed your mask.
And you're keen to stress that people should still be keeping to the rules of social distancing, even though they're wearing masks.
I think a lot of people seem to think that when they put a mask on, that the other public health measures don't need to come into practice. But even though you've got your mask on, it's really important that we keep the other public health measures in place. So we need to make sure that we keep that 1.5 to 2 meters distance. We need to make sure that if we cannot distance, obviously we have our masks in place. If you do cough when you've got your mask on, you know, take your mask down, use cough etiquette, cough into the tissue, and then you bin your tissue and you wash your hands. And most importantly, hand hygiene, definitely.
And importantly, there are also rules about how you should be keeping masks when they're not being used.
Really important, if you're going to reuse your mask again, that you place it in a sealed bag, like a plastic bag or anything, if you're going to place it in your handbag, so that you don't contaminate your handbag or rucksack or whatever. And then when you get it back out to use it again, you take it out the bag and you just take it from the straps before you place it on, and that you're not touching the front of your mask in case you contaminate your hands. But again, wash your hands before you put your mask on, and wash your hands before you go anywhere near your face.